Good morning. This lecture is on solidification defects in dental casting. In dentistry, all kind of dental processes, metal denture paste, removable partial dentures, and fixed partial dentures are made from wax pattern, which will be converted into casting by means of the casting procedure. There are a lot of defects we are encountered during casting. One among them is solidification defect. This solidification defect is due to contraction of casting during solidification. The types of solidification defects are localized ringage porosity, microporosity, and suckback porosity. The solidification defect is further classified as localized porosity and microporosity. Localized porosity is caused by insufficient feeding of the alloy during solidification. If the sprue should not solidify before the feeding is complete, thus preventing a continuous supply of molten alloy. This type of defect usually occurs close to the sprue casting junction. The other type of solidification defect is microporosity, which is caused by solidification shrinkage, but generally happens in fine grain alloys when the solidification is too rapid for the microvoids to segregate. This in turn is caused by the mold or casting temperature being too low. Let's see the three types of porosity. Localized ringage porosity. This is due to premature termination of flow of metal during solidification of alloy. It occurs near the junction of sprue and casting. There is possibility of chances to occur this porosity at the bulkiest portion of the casting. How to prevent this localized ringage porosity? By attaching a large sprue very close to the pattern, about 1 millimeter from the pattern, and also make the sprue thickness more than the thickest portion of the wax pattern. They also make sure that the liquid solidify should come in contact with the liquid in serifier to prevent localized shrinkage porosity. Second one is microporosity. Microporosity is usually irregular in shape, which occurs due to rapid solidification. This defect is not detectable on the surface. It will be seen within the casting, so it can be sectioned and viewed under microscope. This occurs due to solidification shrinkage in the fine grain alloys in the casting. The next one is suckback porosity, which is otherwise called hot spike porosity, which occurs at the junction of the wax pattern and the sprue attachment area. This is due to cooling of molten metal after other areas of the casting have solidified. This in turn creates a shrinkage void or suckback porosity. It may be also caused by improper sprue or improper location of the sprue attachment. How to prevent this solidification defect? By placing the wax pattern at 45 degrees to the sprue and also attach the sprue at the non-functional area. Make sure that there is a continuous flow of metal to prevent solidification defect in dental casting. For further details, you can refer the following textbook. Thank you.